From your PHLV Radio family, Merry Christmas and all the best in the coming year.
Merry Christmas from your friends at PHLV Radio. The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha from the Ninth Island, Las Vegas, Nevada. Magandang gabi po sa inyong lahat. Good evening. Welcome to Healthy Monday with Apina of Nevada. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada and professor at Roseman University College of Nursing. After today, we have 8 more days before Christmas. Yay! Mele Kalikimaka. That's Hawaiian for Merry Christmas. What a great Christmas gift for all of us in the midst of COVID-19 global pandemic. It's flu season, and I hope you got your flu shot. And guess what? Soon you will get another type of flu shot. So tonight we're going to talk about it. Tonight I have a very special guest, Fulbright scholar and faculty at Roseman University of College of Pharmacy. He is not new to our radio program. I guess he must enjoy the past 2 guesting because he's back on our show. Yay! Welcome, Dr. Manas Mandal. Please say hello to our listeners out there.
Hello, all the listeners out there. Thank you for inviting me once again, Marife and Johan, to talk about these new vaccines in the context of this current pandemic. It's so nice to be back with you guys and discuss science, safety, and for the upcoming holiday season, how we can stay safe and healthy and still enjoy our vacations and breaks.
Thank you so much, Dr. Manas Mandal. Manas, I'll just call you Manas since we have been knowing each other for a while now.
Yes, we are colleagues, and I'm not a newcomer to this show. So first name is absolutely fine. Thanks.
Manas, thank you so much for agreeing to be our guest tonight. And I know you have a lot to offer to our listeners out there. You are an expert in the topic, and so I'm so excited. And guess what? Manas had already guested on TV and some of the TV shows, right? And so we are really blessed to have him in our show, in our humble show here at PHLV Radio. So it's a continuation of the information, very important information that Manas is going to share with us. So without further ado, Manas, go ahead.
Yeah, thank you, Marife, for that kind introduction. And once again, Johan and Marife, kindly inviting me once again to talk about COVID-19 infection and particularly the vaccine. So yes, I was interviewed by Channel 3 and Channel 13 2 weeks back several times to discuss 2 different vaccines that are available currently. One is available Pfizer vaccine that has been approved last week. Currently, as we speak in Washington, D.C., under FDA's following FDA's guideline, and they are meeting right now. Moderna vaccine is in the process of being approved right now. Anyone can log into FDA's website to be part of that conversation. They would not be able to communicate with the committee that are reviewing the safety data, efficacy data prior to their emergency authorization approval, but anyone can log into FDA's website to view, to watch the deliberations, discussions about Moderna vaccine. Hopefully everything goes well. And by the end of today, we will have FDA's blessings for Moderna vaccines. Then following that, over the tomorrow and over the weekend, CDC will meet an advisory committee on immunization practices. That's another body under CDC. They will meet and give their blessings, meaning they will authorize most likely over the weekend. So beginning of next week, meaning next Monday, there will be most likely one more vaccine in our public health measures for taking control of the current pandemic, COVID-19.
Yes, Manas, I saw on Facebook that the former hospital that I used to work at,
Yes,
Queens Medical Center in Honolulu, Punch Bowl,
yes,
had received their first shipment. And
yes,
then we had a meeting. I am the chair for education for the many nursing in Southern Nevada.
right,
And we had our
right.
meeting the other night, and UMC, the University
Mhm.
Medical Center, is the
Center.
first facility in the valley to receive
Right.
the first shipment.
Hmm.
So the many nursing Southern Nevada executive board members are planning to volunteer as vaccinators this weekend,
Sure.
um, Saturday and Sunday. And also, you probably know that Roseman University of Health Sciences, College of Nursing, and College of Pharmacy faculty and students are also getting
Yes,
involved.
yes, you are right.
So yeah, it's
You're
a it's a program called Train the Trainers.
train the
Trainers.
trainers. Yes.
Mhm.
So we are, but yes, you're right, Marife. The first recipients of the vaccines for both Pfizer and Moderna formulation will be the first responders, treatments, means the providers, the physician, nurses, and allied medical staffs who are directly in patient care. They will receive the vaccines first, along with the long-term care facility residents, nursing home resident, elderly population. That is phase 1A. Subsequent to that, that will be expanded to patients with high comorbidities, patients over 65 years of age. Then there will be phase 2 and phase 3 slowly that will be rolled out to the common public. To accomplish this tremendous feat, meaning immunizing about 60 to 70% population countrywide, nationwide, there has been many partners such as CVS Pharmacy, Walgreens will be partnering with the healthcare systems and hospitals. To accomplish that, we need many immunization providers, meaning who will provide the immunization, vaccination, or who will stick in the arm of the patients to give the shot. Pharmacy students, nursing students who are trained in immunization, they will be the provider. And towards that, Roseman University of Health Sciences actually created a program. I know for pharmacy programs approach, we already have a service module, meaning students can enroll in that service module and they will be partnered with a preceptor who will oversee the students' immunization efforts. I'm sure College of Nursing has come up with similar protocols where some of the students and trainee nurses, they will be involved in the immunization. And we are so happy to provide this service to the community as an academic institution that operates in the Valley.
Yes, and I've been seeing a lot of information on Facebook and other social media about the known side effects, and I
Yes,
guess one of them is anaphylactic shock, which is the very
yes,
dangerous
yes,
side effects. But there's like the expected side effects, the swelling and the
yes,
redness on the
pain, yeah,
side.
right.
Yes,
Let
can
me
you
talk
talk
about,
more about?
yes, but that's a good area to discuss. And the common people, the listeners should know about these things. Yes, there had been 2 incidents of severe side effects in UK 2 weeks back. By the way, United Kingdom was the first country to roll out Pfizer vaccine, followed by Canada, then US. So what happened in UK, in London, 2 nurses actually, who are the frontline healthcare workers involved in the COVID-19 patient treatment, they opted for the vaccination. Unfortunately, 2 of them out of, at that time, there were about 1,100 immunizations done within first few days. 2 nurses who got the vaccines, or so-called jabs in British term, they call it the jabs or shots, they showed high degree of allergic reaction, almost an anaphylactoid reaction, not anaphylaxis, but anaphylactic type of reaction that are called anaphylactoid reaction. Later, they were immediately treated with epinephrine or adrenaline, EpiPen. Later, it has been found that those 2 nurses are actually atopic individuals, means persons who has tremendous tendency to develop anaphylactic type of reaction, even when they get exposed to seasonal allergy or foreign objects. So it was not very unexpected in those two individuals to trigger anaphylactic type of reaction, but they have been treated immediately without any further concern. Following that incident, now it's a recommendation that in US and everywhere, as a routine protocol, we have to ask the patient or the subject who will be taking the vaccine, are you allergic person? If so, are you highly allergic to any other immunization that you have received before or any other medications that you do take regularly? If the answer is yes, then most likely they would not receive this immunization or vaccination.
That makes sense because that's what I was
Yes,
thinking about. Those people who are already higher risk to react
yes,
to it. Of
yes.
course, they're going to react to it because
React.
it's already in their system about this allergy.
Developing this type of,
Remember,
yes,
yeah.
this type of histamine release and allergic reaction development. It also shows another aspect that this immunization worked the expected way, meaning a severe allergic individual are expected to develop allergic manifestations, and they did. So current guideline is if someone says that, yes, I'm highly allergic to any other vaccines that I have received so far, they would not get that vaccine right away.
So
It
in other
may,
words,
yes,
Manas, if they are already keeping the epinephrine
with them,
injection with them, then
then
that shows you that they are
they are
highly
prone to
going.
develop, higher risk group to develop this type of reaction. And there are very, very few of those individuals who you will find. Common side effects are very mild. Little soreness, little redness, muscle pain, and a little headache sometimes in some of the vaccinated individuals. And that usually goes away within 12 to 24-hour period of time. So there should not be really any worry about getting this vaccine, thinking about getting side effects. It's a very, very minor incident, and one should get vaccines because the benefit heavily outweighs the risk of getting infection. These two vaccines are very effective and efficient at 95% level to prevent the infection. That is huge considering today we have crossed 17 million infections, over 300,000 dead American citizens. With that information, little bit of soreness, muscle ache, redness, swelling, and maybe some headaches for 12 hours in a very low number of vaccinated individuals are very little risk, almost no risk when one compares to getting the infection and possible severe infections and most likely, if not, death.
And like all the other shots that we receive that are routine, maybe I didn't hear about low grade fever. You know, when
Yes,
something is introduced into your body, which is considered
yes,
foreign body,
that's
your
a
own
very good point.
yes,
Yes,
and
yes.
your
Sorry to
immune
interrupt you.
system will react to
Yes,
it, and then
yes,
the fever is because all of
yes.
your white
White
blood
blood cells are
cells
coming to,
are
yes,
rushing into the
rushing to their
site.
site. Yes, let me explain. That's a fantastic point, Marife. Thanks for bringing that up for our discussion. So when someone shows a low-grade fever, little soreness, little swelling, redness, it's called localized inflammation at the site of injection or vaccination. What it does, essentially what you described, that white blood cells in our body, they were waiting as soon as the new object or foreign antigen, which is the vaccine, is injected into that person's arm, they are rushing to that site. What they will be doing, they will be picking up that vaccine antigen, mRNA, going back to our lymphoid organs, such as here, and at that, in those areas, they will start educating other white blood cells, such as B lymphocytes and T cells, to make antibodies and to trigger cytokine responses. And through those antibody production and cytokine responses, we will defeat virus infection if we get exposed to those viruses at a future date, at a later time point. So Little soreness, little redness is actually a good sign that our body is responding towards that vaccination or immunization as it should do. So there should not be any worry about those little redness, swelling, and little muscle ache, and little bit feverish maybe first 12 hours after immunization.
So Manas, this is how I'm looking at it to make it more sense to our lay people in the
Right.
community. As you were talking, I said, "Oh, there are our soldiers in our body, and
They are
also
soldiers.
they're gossipers because
Right.
once the soldiers go in there into the site with had the foreign substance introduced to your body, then it identifies it. They investigate. The soldiers
Right.
investigate what is this substance that's
New
now
came into
entering the
my body.
body, and
Yes.
then, as soon as they identify it, they tell the other cells,
Come
hey,
here.
come here and look at this. Look at
Yes.
it and observe it and memorize how it looks
How
like.
it
So the
works
next
and
time,
respond towards it.
yeah,
Yes.
so the
And
next
memorize
time
it.
it
Yes.
enters,
Yes.
then
Then you
they spread
remember
it
that
out.
I have seen this before through vaccination, through immunization. Let's fight it out. Absolutely, you are right. It's the sentinel system, is the information system that we have in our body in terms of some white blood cells that we all carry. We are just activating them, teaching them towards this vaccine so that in future they can fight out the real infection if one gets exposed to.
Yeah, so for our listeners out there, we have an amazing body. So you have to
Yes,
take care of your body. You have to boost your immune system. And I think the last time or the last two times that you were our guest, we talked
sure.
about how to boost our immune system.
That's
So
right.
our wonderful, amazing body that God has gifted
It
us.
can do miracle if we take care of it and if we allow it to learn some of the things, particularly the current vaccine, current immunization, current vaccines, how it works. Our body will protect us because we have the ability, but we have to give it a chance. That chance is the vaccines. That chance is the immunization. It comes in two doses. For Pfizer vaccine, it's apart, 3 weeks apart, dose one and dose two, prime and boost. For Moderna vaccine that most likely will be released through the weekend, this weekend, is 4 weeks apart, day one and day 28. If we complete those immunization, vaccination, when our time comes, because it's a priority list, government and health agencies are working on a priority list. Goal is to immunize about 70%, minimum 70, 75% population of the US. Then together, we develop so-called herd immunity, meaning a majority number of the individuals are immunized so that they would not get infection, they would not be able to transmit the virus to someone else. We can defeat this infection about this time next year. But before it happens, we all need to be very vigilant, wear masks, practice social distancing, and get the vaccines.
Can you elaborate? Thank you, Manas. Can you elaborate in my mind, speaking on behalf of our listeners in the community? Um, can you explain the wave of the population who's going to get the vaccine and what would be the ages that this we
Yes,
recommended? I'm sure
right,
that we're
right,
not going to
right.
give it to newborns or
Yes, no,
the
no, no.
population.
That's a very good point. So these vaccines have been developed through research in the laboratory. Then they were field tested in so-called clinical trials in human subjects. Pfizer vaccine have been approved to be given to 16-year-old and above age, whereas Moderna vaccine, which is in discussion today, will be approved for 18-year-old of age and above, meaning essentially most of the children have not been tested for this vaccine, so they will not be receiving this vaccine to begin with, because these are all under emergency use authorization, meaning to defeat the pandemic in an emergency situation at a breakneck speed. This is the patient population have been tested with these vaccines effectiveness and safety. Subsequent to the first rollout of these vaccines, Children, pregnant women, and many other categories of individuals will be tested for the safety and effectiveness of the vaccine. Why it is done that way? It is done for two reasons. To speed up the clinical trial process and to release the vaccine for the largest and most vulnerable patient population who can get an infection and severe form of infection and may die due to the infection, which is the elderly population, which is the healthcare personnel who are who takes care of the patients who gets infection of COVID-19, who has the comorbidities. It has been found that children below age 16 or 18, school-going children, they get infection. They're vulnerable for getting infection, but at a much lower level compared to the elderly population with comorbidity, obese, with diabetes, with high blood pressure, cholesterol, etc. Therefore, they were not tested for these vaccines. Because they were not part of this clinical trial, they are not authorized to given these vaccines. But they may as well be very safe, and it may be very effective in them also, but that needed to be tested clinically before they will be authorized to release these vaccines to the children and pregnant women. Very recent data, I was reading some articles today that Pfizer and Moderna vaccines can be given to a pregnant woman under their treating physician's authorization, meaning usually they have not recommended to give these vaccines for a pregnant woman or someone planning to be pregnant in next 3 months. But a new guideline just released today states that the woman who is gonna be pregnant or pregnant, their OBGYN, under their special consideration from their OBGYN, treating physician, they can get that vaccine, but the treating physician should make that recommendation.
They need to be monitored closely
They
for
need
any,
to be monitored
serious
also
side effects.
closely due to if there is some untoward effect, no one expects any, but there can always be. And in that context, I want to give an information to our listeners. Any medication, such as Brufen, over-the-counter painkilling medication, ibuprofen, that we take, many of us takes almost regular basis for regular muscle ache, pains, and etc., headache, that also does have side effects. So no medications is without any side effects that we have developed so far. Meaning every medication carries some degree of side effects, probability of developing side effects. Vaccine, being a medication, it also carries some risks, some possibility of development of side effects.
So as we know in healthcare, we
Yes.
always weigh the benefits and risks.
Risk versus the benefits. If benefits outweighs the risk, and that's a very good point. I must make a comment. I was watching very intently last week as the FDA committee was VRBPAC, which is the Vaccine and Related Biological Products Advisory Committee. This is an advisory committee who works with FDA. They are not appointed they are not salary earning employees of FDA, but it's a committee made out of the physicians, scientists, nurses, clinicians, ethicists, and lawyers throughout the country, voluntary committee. And they were meeting and discussing Pfizer vaccine approval process. I was watching that last week. They voted on one single question. The question was, does the provided clinical and scientific data outweighs the risk and goes in favor of the benefit? That was a single question they voted upon at the end of their day-long deliberation. So yes, as long any medication, including this current vaccine, outweighs the risks and goes towards the benefit of the patient, protecting them against future infections, that will be approved, and that is a good vaccine to take. And today they will be answering the same one question. Does Moderna's clinical and scientific evidence outweighs the risks and goes towards the patient benefit, protecting them against COVID-19? They will be voting today again, the same committee. Currently, right now, they are in deliberation in Washington, D.C. Actually, they are meeting virtual, like we are talking, no one meeting in person. Following the CDC's protocol, they will be voting on the same risk versus benefit question to approve Moderna vaccine formulation by this afternoon.
Like any other treatments and procedures, there's
Yes,
always this risk and there's always the benefits. And
benefits.
remember, our listeners out there, when you have been recommended for surgery, your physician or whoever is going to do the treatments
Surgery.
or surgery, they are obligated and required to discuss with you the
Yes,
benefits and the risk. And
risks
so
associated with that procedures or process.
yes. And you're also entitled to have a second opinion,
Yes, always good to get a second opinion about those surgical procedures, etc. But for this vaccine, that second opinion or many opinions, fortunately, taken by the experts. All we have to do, trust their judgment, trust their experience and expertise, because these individuals are in this process of research, development, vaccines, etc., immunization throughout their life. Someone has 30 years of experience working on vaccines and immunizations, etc. So
like Dr.
we have to,
Fauci, right?
Dr. Tony Fauci, and through
Yes.
many other individuals, Marian Gruber, I can name many, Dr. Osterholm, Dr. Gruber. Many of these individuals are the leading authorities of vaccines, immunizations, and infectious diseases in the world. So we have to trust their expertise, and they have our interests in their mind when they take the decision. So that second opinion is coming, first and second opinion is coming from the vaccine manufacturers and this expert committee. And if we uh, give our trust, keep our trust on their decision-making process, which is a very rigorous one,
People don't
then we,
understand the long, rigorous process that's
yes,
involved before
in
medications or vaccines like this
vaccines
are
are
released to the public.
public,
And
yes,
we have learned a long way, being
yes,
in research and in healthcare, and you have more experience
in
over me with the
research,
research,
yeah,
but we all have to understand and learn along the way that history had taught
yes,
us a lot to protect ourselves and our
yes,
and the people
and the
at
people,
large.
yes,
So
yes,
just like what you were saying, they deliberate, all these people who sits in the committee to
yes,
protect the public are
yes.
really at your
That's
best
in their
interest
mind. That's
because they're
one
part
single
of the
question.
community, right? They're part of the
They are
public.
part of the community, and that's the single most important conversation I heard. I was listening, following that meeting last week for about 2 to 3 hours, and I took detailed notes. Single most concern and question is that safety. Yes, it is effective, which is good thing. How about safety? And they actually analyzed, deliberated that usage of that vaccine, Pfizer vaccine, in children, in pregnant women, they covered that aspect. And it is so good to hear them that they expressed their concern. They advised that, yes, we will authorize it, that these vaccines for those two patient populations, but why don't you do a controlled clinical trial in children, in pregnant women, and in patient populations with high allergic manifestations, high possibility or probability of allergy. Only then we will recommend usage of this vaccine in them. So when we hear those type of comments and those type of concerns to that detail, looking into vulnerable patient population, then we have to place our trust in them that they are looking after us.
And they need to know the outcome.
Yes.
Everything that's introduced out there, it need to be tested. And
It
of
needed to be
course,
tested.
they are ready. They are obligated to be ready to provide any intervention should severe side effects happen.
Yes, yes,
Yes.
that's another guideline. Thanks, Marife, pointing that out. Sure. Out of this UK incident of anaphylactic type of allergic reaction in these two nurses, and there has been reported one such incident in US also. It happened yesterday. Now the standard guideline is that any immunization provider, be it a hospital, be it CVS or Walgreens pharmacy, they have to have treatment facilities available, such as oxygen, such as epinephrine, such as antihistamine or little steroids, dexamethasone, anti-inflammatory drug. If there is such an incident occurs, we have to treat that patient
Yeah, and they
before
really
we
should
let them
have
go.
a,
Yes,
yeah, they should have a code card or
yes,
somewhere
yes, and
nearby.
yes, and the vaccine recipients or the patients will be asked to wait for 15 minutes, and people with known allergic history, they will be asked to wait 30 minutes after the vaccination or immunization so that they can be properly monitored and receive treatment if something like that happens in them.
Yeah, you reminded me about the recent community outreach that we did in
Yes,
Chinatown Mall, where we actually changed the title of our community outreach activity from drive in to drive up.
drive
So
up.
the participants, community participants, would drive up with their cars,
Yes,
get the shots while they're in their car, and they have to park on the side and wait 15 minutes to be
15 minutes
monitored
just to
for side
monitor.
effects.
Yeah, make sure that there are no side effects. And that brings another point that this could be a difficult flu season also. Along with flu season, this COVID-19 can make some of our life very miserable. We have good vaccines against influenza that's standardized for many years now. I personally get my flu shot as soon as it's available by September, mid-September. I already gotten mine in mid-September. I hope our listeners, they already gotten there. If not, it's not late. Please go out and get seasonal flu vaccine. It will protect us against seasonal influenza. And when time comes, go get your COVID-19 shot because it will be rolled out in phases. You will be notified when it is available for your age group and your category. Go there, get it. You will be given a card that will document your first immunization, what type of vaccine has been given to you, either it's a Moderna or a Pfizer formulation, and through your cell phone messaging or other contact methods, you will be called also to get the second immunization at the same center in 21 or 28 days apart. If we take these two vaccines, then we can protect ourselves, and not only to us, it will protect your family member, your friends, and the community where we live in. Because if I am protected, I would not get the infection. Therefore, I will not spread the infection in my community. So as a whole, the community becomes protected, and that is so-called herd immunity. If sufficient number of the people in the community gets these vaccines.
Do it for the common good, right?
Do it for the common good, do it for yourself, do it for your community, your friends and family.
And so the silver lining, we see the silver lining with all of
Yes,
this COVID-19 global pandemic. So pretty soon, so I can't wait for 2021 to come already.
me too.
It's like,
Yeah,
come on, let's
come on,
let's
it's
let's get
about time.
moving.
Yeah, it's about time. You said it very right, rightfully, that there is a silver lining at the end of a very dark tunnel. And I take it personally, it's Santa's early arrival in infection land. It's
Yes.
Santa. It's Santa's arrival in infection land. We are going through this infection for most part of this year until now. Santa has arrived in the form of vaccine. Take it. Welcome, Santa, in the form of vaccine in your body, in
Hallelujah.
your home, and it will,
Hallelujah. So
hallelujah, and it will bring joys.
And in the meantime, just like you said, you need to get your flu shot, protect yourself and the people around you, your
Yeah.
loved ones.
Yes.
I remember I got the flu shot to protect myself, and also it's a requirement for us before we go
Yes.
for
As a
clinical
practicing,
rotations,
yes,
right?
absolutely.
And I had taken, I was kind of scared, but then I said, I just need to protect myself and be
You do.
vigilant.
You
We're
do.
required to wear a face mask and
Face
also face
mask.
shield.
Yes.
So
Yeah.
I went in into one of the facilities with two groups of students on different occasion, and it just so happened, someone tested positive, not because of our rotation, but because a family member visiting from
Visiting
California
them, they got exposed. Yes.
got exposed and was hospitalized,
Yes.
and then he tested positive. So all of us have to get tested. So for those who don't know yet where you need to get tested, just go online. Um, I went through UMC, um, sn.com, and then you
Yes.
can schedule your appointment. I
Yes.
got to go to Cashman Center,
Ashwin,
and
that's
they
the
will
best
ask
one.
you, yeah,
Yes.
they will ask you if you are in the healthcare field, and so they will expedite your result. They will give you a link, and then you can
Yes.
just keep on checking the link, and thank goodness, my son and I tested negative, so we're
That's good.
okay.
How long
So
it
really,
took you to get the results, Marife?
within 24 hours.
That is very good. That
Yeah,
is
so it
very
was
good.
a Saturday, and then I got it. I guess a little over 24 by early morning of Monday.
Monday.
They probably checked it already Sunday, and then in the morning
Okay.
I saw it. So
Okay.
I think, and a lot of people, I don't know if they did a study about this, that if you wear face shield, it really is going to protect you more.
Yes.
One of my colleagues said that one of the doctors who have a clinic, all of her staff tested positive except one staff who consistently wear her face shield in addition to her face mask, and
Yes.
she didn't get it. She tested negative.
Yes.
So
It creates a double barrier. Essentially, here is the face mask I always wear. And if I go to a doctor's office for my regular PCP visit, I put
you
a
wear your shield.
N95 mask or a facial. So it creates a double barrier. Scientific research has been shown that wearing something like this, a three-ply mask, non-surgical mask, or better surgical mask, can prevent virus transmission about 70% level. A simple mask wearing like this can prevent us getting infection at a 70% level. And if I put a face shield along with this mask, that's a second barrier. Almost someone is almost protected, even they are around another infected individual. So you are right. If we go out to a hospital or a doctor's visitation, we need to wear this and if possible a face shield as long we can keep that on without compromising the checkups and everything. But that
and
should definitely protect. Wash
and
your
the
hand.
physical distancing.
Yes, keeps the physical distancing. Wash your hand for 20 seconds. And if we maintain all these things for 3 more months through the end of March, April, by the time many of us will get a chance to get vaccine, we will overcome this pandemic successfully. But we need to push ourselves these few months before we really have a, again, pre-pandemic life back to us again.
Wow, Manas, we have talked a lot
We did.
about how the community
Yes.
can protect themselves, not only with the mask and the face mask and physical distancing, but also
Yes.
our Christmas gift, which is
Christmas,
the new vaccine.
I consider it's the greatest Christmas gift to the community, to the entire nation, that nothing is more important for us than our well-being, good health, and healthy life. So this is the greatest Christmas gift to the nation.
Yes, true. And also, well, it's always a pleasure having a discussion with you, Manas.
Thank you, Mary.
I'm really getting to know you, and hopefully, our research project that we're working
Yes,
together will pull
we
through,
will.
and
Yes,
many more research project to work with you.
yes.
And our listeners out there, thank you for tuning in to Healthy Mondays, and I hope our episode tonight had given you some hope and some light of hope and
And
courage.
information and
Yeah.
relevant good information about this vaccine, about its safety, and little bit of guidance that get it when it times you are up for approved for getting the vaccine, when you have the time to get it, go get the vaccine. It will save you, your family, and the community.
And continue to educate yourself, be
Yes,
vigilant.
yes.
I know Filipinos um, like to party, and so
Which is a good thing,
so
but party safely. Party
party
safely.
safely, yeah,
Yes.
safely and fun. We're actually, I want to plug in our first virtual Christmas party. We call it Pandemic Party for the
Pandemic
Apino of
party. Wow.
Nevada. It's going to
That's a
be
good
this
name.
Saturday at 6 p.m. to 8
Okay.
p.m. So
Okay.
check out our Facebook page, Asian American Pacific Islander Nurse Association of Nevada. There's a link there where you can register. You have
Yes.
to register in order to join us. And we have some prizes. So we're all about fun, but we still need to be safe. So
Absolutely.
time flies when we're having fun,
Yes. Yes,
Manas.
it does.
So
We
thank
always
you
have fun.
again. Thank you again for being our guest tonight. Thank you, PHLV Radio, for our community partnership and our community out there. Please educate yourself, stay safe, stay healthy. And from on behalf of Apino of Nevada, Melikaliki Maka and Haoli Makahikiho. That's Hawaiian. So Merry Christmas and Happy New Year.
Merry Christmas and
I don't
Happy
know
New
if we
Year
have
to you all.
another Monday. I think next Monday is still December. So
Till this.
anyway,
Yes.
remember, mga kababayan out there and our listeners, every Monday is a healthy Monday.
Yes.
Aloha.
Aloha. Thank you.
Thank you, Manas.
Bye-bye.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.
From your PHLV radio family, Merry Christmas and all the best in the coming year.
Merry Christmas from your friends at PHLV Radio.